everybody. Welcome to Psychological Journey. I am Barbara Renzi and I'm here with Giulio Napolitano. Today we are going to speak about artificial intelligence and therapy. In particular, there will be some example of CBT. But now, please introduce yourself.
Yeah, okay, thank you very much. Hi everybody, so I'm Giulio. I'm working here in BSBI for some time. And yeah, I've been in the field of artificial intelligence for a long time. Yeah, I started with, let's say, the old-fashioned, logic programming and then semantic approaches to knowledge. And now, of course, we are in the area of large language models. So it's much more powerful now, much more complicated as well.
Yeah, and artificial intelligence and therapy is very much a hot potato, let's call it this way. It's very much an hot topic and hot potato, and it's important that we talk about it. I'll just go with my punchline, directly with the punchline. The punchline is logically, people use it. It's there, and we have to make sense of it. But as a CBT therapist, I say we have to pay attention. It's not totally safe. We know there are lots of cases. So what can you tell me about that?
Well, I mean, something that I know I've seen over the years is, of course, something that everybody else has seen, the power of these tools becoming higher and higher. And of course, the big change in the last few years is that artificial intelligence now is really as expanded in the area or in the realm of language, which is what most people associate with intelligence, of course. Before we had intelligence systems which were, let's say, a bit isolated, a bit specialized, but language was not really solved as a problem. And now you remember also the Turing tests, at the time, the test that was many years ago devised as a way to understand, is a system really intelligent? It is really intelligent when you talk to it and you can't understand, is this a person or not? Now, we are in some cases where I'm on the web, I'm with a tool, on a website, in the customer service, and realize I don't know whether I'm talking to a person or not. So, that test, in a way, we are beyond it. And now people say that's not the test anymore. So this means that people use it in every kind of approach, every kind of problem that they have, they can use it, because language, you can do almost everything with language.
Yeah,
so I think that's the main power, but also the main issue that comes with it.
No, I agree. You think it's intelligence, but here intelligence is a metaphor. Okay, it's intelligent because you can speak with it. So you think it's we as human beings, we have this idea of personification. So become a person. We just, I don't know, when I'm angry, I speak with my dishwasher, because it's a way which we communicate. Okay. Then I know that dishwasher is not a person, but, just, this didn't go well, And it's for us a way of, we give a soul to everything that is around, And also we speak with different types of things, and sometimes we just project what we think it's us in other object, non-object, plants, animals, and we have this speaking that we think, okay, this is intelligent. But yeah, it's not enough, because as you agree with me, there is no empathy. There is the mimic empathy, and yeah, my second punchline, and maybe you can comment on this or other issues. My second punchline is that when I studied therapy to become a therapist, I should have chosen, okay, there is CBT, there is psychoanalysis, there's a humanistic therapy, and honestly, when in each book, and when you speak with the really good therapists, what they say, what counts is the alliance. So the alliance is the one between you and the therapist, is the one that makes you feel different, makes you well, okay? And in fact, I tell you, if you don't like the therapist, I mean, it's useless to go there. But there, this empathy, this alliance, maybe is not really possible, no? Or is it possible? What do you think? I mean,
I really don't. I don't know. I think that nobody knows, and there are all different points of view. For instance, recently there is.
I can't hear you.
Yeah?
No, recently?
Recently there is. I mean, there are a lot of people who are starting to think, well, maybe language on its own is not enough to actually have intelligent system as we think, a human can be intelligent, for instance. There is Ian LeCun, one of the godfathers of, let's say, of artificial intelligence. He says language is just, let's say, a manifestation of thought, but thought is much more than language, and intelligence needs thought more than language. Now, I don't really know what exactly that means, because I don't know how you can define thoughts in a way. Also intelligence is something that everybody defines in a different way. But as you said, we have to go beyond. If you are going to if you are talking about therapy, you are talking about the empathy, the alliance, having the other person really being with you with all kind of aspects of their being, not just thoughts, for instance. So in a way, this is something that, as you said, can be mimicked. This system actually, I've seen a lot of evidence, a lot of papers, a lot of studies where clients, they actually say, well, I solved so many problems with ChatGPT that in 15 years of therapy I didn't solve. Or people say, well, this actually sounds much more empathic, and it's there all the time. I can actually, they actually have some benefit. And this, as you said, we can't really ignore it. It's there, and we have to cope with it. But we also have a lot of evidence about the problems that you said. Okay, there is no alliance, there is no common goal in a way. When you have an alliance, when you have a communality, that means both the therapist and the client, they have a common goal, to get better, to have a better life. If you are talking to a system like this, that the way it is right now, the system are right now, again, I repeat this, every time, everybody knows already, but it needs to be underlined. These systems are statistical systems. They just tell you, give words as they are likely to be given by an average person who has a lot of knowledge, but that's all of it. And the risk is that, for instance, they can reinforce in your problems, as far as I have seen also in the news, people who harm themselves, or they were reinforced in their very kind of weird or, very dangerous thoughts, because again, these systems have been trained in a way to please you, in a way, to actually help you, because this was the original idea. We want this system to be helpful, but helpful, what does that mean?
Yeah, helpful. This is very interesting, because it depends what kind of therapist you are, but sometimes we say to the clients or to the patients, that's why I would say what kind of therapist, because clients in one language, patients in the other, we just say, you know what, this is bullshit, yes, sorry for the word, but we confront them directly, and does ChatGPT do that? Does ChatGPT confront you always? Or does artificial intelligence confront you with the reality? And you have to have somebody. And then there is another distinction that it's on mine actually, but between trust, what can you trust and what is reliable, okay? And you trust a person, you trust a person, but the relationships are different. Are such hard work relationship, with a friend, with a deeper relationship with love, are hard work, and you can trust them, but sometimes there are fight, a discussion, and also with the therapist, the relationship is very much complex, because first of all, it's a human being. Sometimes although we go there with the, open heart, just try to hold your, whatever you bring, we are people, so we can be moody, okay? There is a bit of mood showing up sometimes. But it's a relationship, and so it's based on trust. With, a statistical model, you cannot have a relationship, but when you go home, you can rely that it's there if you have internet and can give you an answer. So there is a distinction between trust and reliability. Rely on something. You can rely on your dishwasher, washing machine, hair dryer, and so you can rely on this, but you cannot trust. And I think trust, love, empathy are the main things.
Yeah.
You can emulate, that's what I believe.
Yeah, I think it's crucial because, at the end of the day, we are talking about this particular domain of helping people to get well with their life. So it is very delicate, and it's different kinds of requirements, let's say, from other kinds of domains. So for instance, now, the dishwasher now, okay, you said you talk to your dishwasher, and now we have dishwasher they can talk back, right? So it's in a way, we are getting there where you have this, let's say, artificial relationship with an object that looks like, that you are interacting in a meaningful way. It is meaningful for washing the dishes, and for you maybe to vent your, your frustration or whatever. But in terms of the actual trust and relying on somebody else, that's one thing. For instance, I have seen reading around is that there are specialized tools, but they are getting better. But one thing that, for instance, these statistical models have also, they don't actually remember everything. So one of the things that therapists, as far as I understand, you actually remember everything that you've done with your client, with your patient, and then you can, let's say, join the dots and understand, okay, maybe there is something here, and you remember also from other settings. It is a dynamic process that requires a lot of memory, a lot of understanding of the other person, which again, this is not yet possible.
Yeah, because you're right. It is the body that gives you ideas. How you understand the position of the body. Also, particularly if you do psychoanalysis, you look at the clothes, and you spend the first 5 minutes looking at the person in front of you, and the clothes is that if a woman has makeup, doesn't have a makeup, or everything is very colorful or not, is what kind of clothes. And when he entered, was speaking very quickly or was speaking very slowly, was giving me everything in a moment, or was giving me, slow by slow, was telling me everything. And especially with psychoanalysis, when the therapy goes, more than one session, you start speaking about family. And, okay, maybe the person in front of me didn't speak about father, didn't speak about mother, you just trying to understand why didn't bring up this subject. So how can you do that with a model, which is, it's very difficult. I agree with you.
Yeah, again, I don't really know what the future will be, because in the end, some of the things that you just mentioned, I was just thinking, can you do that? Not yet, but you can actually do. There are a lot of tools in AI now that are suggest to you what kind of clothes you can have. Because now we have multimodal models, which they don't actually use only language. They also use visual, audio, and other kinds of let's say, sensory inputs, or other kinds of data in a way. So I could expect, I could imagine, a short-term future in which these modalities could be, combined together, and then again approximate that kind of behavior, or that kind of, let's say, first understanding of profiling of the person a little bit. Okay, this looks like, they presented themselves in a certain way, so I can already maybe think about, assume some characteristics of them. But then, of course, you talk to them and then it forms. But I think, again, this is on the surface, and it's hard to tell, what will be in the future. Right now, we are definitely not there. So I think, then the main risk is that we are using, people are using these models that are helpful, they find help, but only, I would assume, only when they don't have real big problems, which means, you can talk to them and then they give you some initial relief and it's fine.
Actually, I tried them. I tried them for stress management. Okay. When I have lots of tasks to do, I feel overwhelmed with work right now. And so ChatGPT helped me to break it down, okay? Helped me to do a structure or break it down, okay? What should I do first, this task or this task? And so, yeah, I chat, I don't say everything, but it gave me a short checklist to organize my work. So I done that. And then, I said, I'm thinking I'm going to fail, which is, I'm going to tell you my core belief, but it's pretty much clear from this. And with ChatGPT, it says, let's examine your thoughts, what evidence you have against. This is what we do in CBT, actually. And so we chat, but I don't know if, because that was just me trying, so I don't know if, in a way, being a CBT therapist, I was, kind of giving extra information. So it was just...
you knew what you were talking about, yes.
So in a trial. And so it was like, what evidence support you are going to fail in what case, what evidence support it, what evidence are against it. So it really worked. But, I think this is what also a counselor, which is not a therapist, a trade, when you need, a quick fix, sometimes you're overwhelmed, which is normal. Each of us, I mean, each of every one of us is overwhelmed, sometimes. So this is not for really more troubling psychological, things that, again, are also very common. We don't know, but they are very common. So, yeah, maybe I think it can be useful for certain things. It can be useful. I mean, but yeah, as a surface thing, if you have a burnout, you cannot go to, burnout for work. It's something different from stress management because you have lots of work and, you just say, okay, I cannot do it, and yeah, it brings you down, ground it a bit, if you don't have anybody to talk to.
Yeah, I mean, see, what I think, again, so the people who really will benefit from it are the people who would actually who have less problems, who are actually, they know what they're talking about, they know how to ask, what kind of things they want to achieve. But the people who are a little bit more, let's say, lost, I don't know other words, I'm not a therapist, but, the people who are a little bit more lost, they are at the risk of getting even more lost, Again, could be that it is improving for them, their situation, but in other cases, randomly, because again, this is a statistical tool, it could be worsening. And we have seen now also, I mean, regulations now are coming in. You know that there always is this kind of big difference between different countries, like, for instance, the US and Europe, Europe, always been seen as, okay, we are regulating too much, you are trying to put too much guardrails. But in US now I have seen in the last few weeks, like last week or 2 weeks ago, in New York, now they're introducing legislation where if a model cannot detect that the person that is talking to the model could be at risk of harming themselves, if they cannot do this kind of detection and let's say do something about it, then the model should not be deployed. At least that was my reading. I just read briefly, but that is the direction in which everything is going, because people are realizing also in the regulatory area that in some cases this is too risky, and we have seen already events where people really harm themselves in a serious way.
For a while I worked in in a charity which was for suicide prevention, and we were always 3 people there, because and I was very I was not the expert. It was supervisor was very expert, and you know, we were always 2 when something was going, because you know, did I really understood properly? You know, the question, you're there, you're never sure 100% if you're young or everything else. And it was really good that there was other people there to ask after if we were not sure. So even human beings sometimes, you know. But on the other hand, if you know, to find a psychologist in a city like we are in Berlin, as BSBI is in Berlin, as you know, this branch, we are here from Berlin filming, and it's very difficult to find a psychologist. It's extremely difficult. So if you don't have anybody to talk to, and
people do what they can.
yeah, I mean, why not? You know. On the other hand, if you have, but you have to know that is not a human being. It's a statistical model. It can help you a bit, maybe to structure your thoughts, to ground you a bit. You have to know that there are risks, and you have to know that I believe that sometimes, you know, it's also that you rely on it too much, you know. And the other thing that, for example, what we do as a CBT therapist is that there is all psychoeducation, and you have to become your own therapist at a certain point. How can this happen with the? I mean, if you go and rely on this because you want, you know, to express your, you know, your anxiety and everything else, and I don't think there can be psychoeducation as we do as a therapist. But you know, I know that in big cities, that you know, like Berlin, and I think in Germany there are other cities, there are not enough psychologists. So
yeah, I mean, one way, you know, I've seen also there are many experiments, many products coming out, you know, that specialize in helping the actual therapists, you know, in coping with this. For instance, you know, you could imagine maybe some of these tools could be a first step where, you know, there is like a triage kind of approach where you know, a tool could judge initially what is, you know, what people are at risk or which ones are a bit less. Then maybe you can prioritize, you know, if the real, you know, the human psychologists are scarce. That could be, I mean, just actually thinking about it coming to my mind, that could be an idea, for instance, because, you know, when you have a tool, when you have a model which is highly specialized in one single task, for instance, you know, deciding how serious could be the condition of this person, then maybe the risks are a bit less in having the wrong judgment. That could be a way, I don't know. But for sure, I think, you know, this should be much more in the hands of people who know what they're talking about. So to be more controlled, and people should be more educated in understanding how they can use it. So it's also a matter of education, and also, you know, the providers, you know, now the regulators, even, you know, countries which are a bit less keen, the providers should be more proactive, you know, instead of, you know, trying to launch, you know, the newest model, you know, the fastest model or the most performant model. Now we know what these models are used. That's the problem. You know, at the beginning, these, you know, large language models that were deployed, and nobody really thought how they were going to be used. Now we know what the risks are. So there is no excuse, in a way, not to think in advance, you know, proactively, how can I prevent these things, you know, bad things from happening.
yeah, that's true. But for example, when you lose somebody, one kind of therapy which is very much was by Dr. Meshia here, it's like to create an object of memory. Okay, object of memory is created with the photos, and you know, so you go to your therapist and you bring photos, okay, of you and the person that you've lost, and it's really in the talking, when you put the photo on the table, you describe the photo. It's not the object at the end that make you, you know, feel better. It's the talking, the understanding of what happened in the life, showing the photo, putting the photo together. It's something that can last weeks and weeks because this is more psychoanalysis. It's a kind of new wave, you know. And how can you show a photo to a statistical model, a spoke, you know? I feel, you know, we are still.
I can see ways you can do that in a way,
yeah,
but
from my point of view, you know, you see, you need somebody you have to lean on and say, you know, this is what happened. This is before this person got sick, and we were kids. Look at this photo. Oh, look at the funny hair she had, or he had, you know. Oh, look, he was terrible with these glasses. Why on earth, you know? And it's all the process going on and on and on. And at the end, you build this film with the right music. You choose the right music, you know, for the film. As you know, and it goes along on and on and on. At the end, you have this object of memory that it's not the object itself, but is the construction. I mean, so.
Yeah, no,
you know, from my perspective, you know, I think it.
But I mean, this. I think again, you know, as I mentioned, some researchers now, you know, some of best researchers actually they are thinking, okay, we have to go beyond, you know, the language or even multimodal kind of models. We have to go towards the so-called world model, where you have an understanding of really what the world is about. I don't know how you do it. You know, there are some people who are trying to now to make new, you know, startups or adventures, you know, to try to see how this could be done. Again, it's very difficult, first of all, to emulate something that we don't know about, because you know, while we were talking, I also thought, you know, sometimes even humans, you know, even we can sort of emulate behavior, right? So if you can say, okay, for instance, a lot of times I've seen, you know, in news or in papers, you know, the clients, they say, well, these, also not just in therapy, these tools are very much more empathic, you know, they understand me much better, not just in mental health, but also, you know, talking to genetic doctors, there were experiments, you know, that I can understand very well, you know, because, you know, notoriously a lot of let's say primary care doctors, they are not immediately available for explanation, let's say. So in a way, you know, this kind of empathy or understanding can be emulated, and this is something that also happens in humans. But how do we understand when this is real and not emulated? I mean, can you do this in humans, even there?
I mean, I don't think, you know, I mean, what I think, and knowing you, we feel it. You just say it's not enough, but you know, sometimes I think I think we feel it. You know?
I think, yeah, I mean, this is actually along the lines of having the knowledge of the world, not just the language, not just looking at things, but just looking at the additional signals, you know? Even, for instance, as you said, somebody enters the room, even the noise that they make, you know, with the feet, you know, gives you an idea. And again, this maybe could be modeled in the future, you know, at some stage, but right now we are not there. So now, you know, the talk today is about what we are now facing with. We are very far away from something that actually can be a real therapist, I think,
I mean,
for people who actually need it.
You said the world. What do you mean by the world? Because there are different worlds in the world, so you have to emulate. You know, cities like Berlin. There are different Berlins, and then we have Germany, and then there is Southern Europe. I mean, you know, and then there is, you know, also we know that, you know, not everything is in these models. Is go more for the West part. So I mean, how can you also? You know, when you come from a particular kind of countries and you come to more the West medicine, and you have a doctor with the DSM-5 revision, and in front of you, and there's a person that doesn't want to speak with you very often. You know, doesn't maybe you think, okay, this is schizophrenia. I mean, and instead is something else. It's something about your culture, how, you know, explore, you know, certain facts that happen in your life, and you tell stories. I mean, I'm not an expert in anthropology. So if the doctor, you know, I mean, doesn't want to explore you as a person, doesn't ask you where you're from and everything else, maybe, and it's very superficial, you just say, okay, this is schizophrenia. Well, it's very much totally something else, and it is a person that maybe lived in a city like Rome, where we have people from all over the world. I mean, and
Yes.
how can you do, because it happens to me, I've seen that. So how can you do that with a language model? So,
But yeah, I mean, I totally agree with this, and I think it goes back, you know, to the another. I mean, of course, now we're going to philosophy here, but it is also the problem that I guess it's also a little bit inherent with all the medical and, you know, mental health profession of defining what normal is, right? So if you have a behavior and you want to correct it, it's because, you know, the person feels that there is something that is not like good, but in the environment. So maybe, how do you define normal? Then even for us, it's hard to tell.
no, I'm
Well,
not saying that you define normal and non-normal. Just I'm just saying that we are from different culture. We explain, for example, sadness in different ways.
I see, okay.
So we explain sadness in a different way, and for some people, you know, I don't have a specific example now, but you know, doing certain things, it's a way of expressing sadness. Maybe you come from a different culture, you don't know that,
Okay.
and you say, okay, this is, but this
Yeah,
is,
no, right,
but you know, if you realize that somebody is coming from a different culture and you are a serious professional, you start asking questions and take information from this culture. But on a statistical model, there is not each.
Yeah, I mean, this is the problem of bias, right? You know,
Yeah.
when you have a model that is trained, you know, on data which is coming especially from a certain population, for instance, then you're not going to work well with other populations, for instance. You know, this happens, you know, also for humans. You know, we have
Yeah.
the example, you know, when we were in the UK, you know, and then people, you know, in the UK don't really know exactly what kind of conditions you may have in the Mediterranean area, for instance, and you have some symptoms and they don't realize there is something that is typical from some areas of the world which are not there.
Yeah.
It is not because they're bad doctors, you know, because they're biased in terms of them being trained with a certain kind of a set of books. Maybe the data was there, you know, they should have remembered, but, you know, they don't have cases like that. So they forgot, you know, that's also human. Yeah, this is more on the technical side, I would say, that you could still, because I'm always thinking, okay, can you do this in the future? I totally agree. Right now, we are not there even that. So that's an additional problem that you have with these models, definitely. So if you are from a culture or from a group which is not well represented in however this tool that has been trained, definitely the help that you are going to get from these tools is going to be worse. That's completely true.
But my punchline is anyway that you can become as good as you wish, but you need people because you need this relationship which is human. Because you know, you cannot have you know, imagine it's that, but it makes people feel better. But on the other hand, I wanted to say that sometimes it's difficult to speak with a person in front of you of something that happened to you, or something that you do that is wrong, because you feel like, you know, how can I say that in front of another human being? And maybe saying in front of a machine, you can do that.
Okay.
So I would say, you know, if you have a particular problem or you've done something wrong, maybe for some people it would be easier, you know, because they feel shame and guilt. It would be easier to speak with. So maybe, you know, they should go together maybe in future somehow.
Yeah.
Maybe, but not. I don't think they can. You know, it's.
Yeah, it's here to stay.
Yeah, because it's here going to stay. But for me, you need a person in front of you. Maybe, you know, a trained, licensed person.
Yeah. But I see, for instance, again, a lot of experiments. For instance, can you imagine a way where a therapist could could use a tool like this, to say to the client, okay, maybe if you want to speak with the tool, and then after a while you can review what the conversation was like. And then you talk to the client directly how it went, for instance. Because maybe then, as you said, some people feel a little bit freer to talk to a machine.
Yeah.
And then, you could say, okay, now you talk to the machine, I'm going away in a different room, and then afterwards you review together. So maybe there is a bit more freedom there. That could be
that's what I think it
business
can
idea,
happen.
maybe?
That's I think what it can happen, because when you write a big secret, you want to say a big secret, but you cannot say to anybody, kids, they write it on a piece of paper, then they destroyed it, or they put it somewhere in the garden, it's just, my secret is there, nobody knows, but it's out of me, it's there.
Okay.
So I think it's the same kind of approach. So this is what, I mean, there are, cons for sure that, is there when there is nobody there, and yeah.
But needs to be under check.
Yeah, for sure. That's what I think. And I think
we could talk for hours.
Yeah, but maybe you have questions.
Some comments or experience. I don't know.
I know.
You must have something to say.
Have you done an experiment like me, asking, I'm thinking I'm going to fail, and let's examine your thoughts? Nobody?
Yes, there is one. Anna Maria.
Hi, thank you for the super interesting talk. Can you hear? No? Oh, you need to stand up. Yes. So I was thinking about using AI as a tool here, right? Many people like doing reflection with the journal. It's just a place where you put your thoughts, and then you can look at them as you write them, and you become, better at noticing your own patterns, right? It's just a tool. Nobody questions this. Many people do it, and it helps them. It's proven to help them. So in a way, from my perspective, AI is the same thing. It just responds. So it is about really how much trust you put in it as a relationship, but it's fundamentally a different type of relationship. But I really liked this example with being overwhelmed and having GPT tell you that you should break the task in mini tasks or something like that. And I was curious, from the perspective of the psychologist, how do you know what to recommend? I mean, how do you know what the problem is? Because I think this is, from the AI perspective, this is a hard thing to put in. How do you know if you need to recommend strategies to deal with multitasking or splitting this project into small tasks, or if it's like a motivation problem, or if it's like this is not something authentic for them, you should recommend to them to change jobs? How do you know at which level do you solve the problem? Because I'm curious from the AI perspective if there's any technique to tackle that part.
The thing is that you speak with a person in front of you. I mean, for me it was just, I probably I should have written the prompt, okay, I didn't. But for me it was, you speak with a person in front of you. Practically, CBT, cognitive behavioral therapy, gives you these tools, okay, give you psychoeducation, so it gives you the tools. So, and if you come with a problem, at the beginning of the therapy, which is 8-12 weeks maximum, you just came with a problem. Okay, the first day you came with a problem, and you discussed the problem, and if it's stress at work and everything else. So you realize that, and I think you decide if you have to other things. First of all, it's never okay. Depends on the kind of therapy. Sometimes it's sad. Okay, it's not a counselor. Sometimes they say things how they are. I mean, this is my perspective, but you speak with the person and you realize, you ask the question it's called Socratic, it's called Maietic, it's the Socratic way. So the person already, know the answer, and you ask many questions, and you see if it's really because there is no motivation or there is something different. It came out. So I don't. I don't have a simple answer. It's just in the process. But I try journaling. You're right. I ask because I have these things of, I think CBT with me, myself, it doesn't work very well, but I tried anyway. Being trained, I have a journal, okay? It's on my bed, and no, on my bed, it's the table near my bed, and it says, before going to bed, I should write something in my journal. So just to build myself. And sometimes, I kind of, it's hard work not to write on the journal. So I asked for to CBT to give me prompt, and it gave me great prompt. I know the prompt, but to give me also a bit, it gave me a great prompt. So we can use it also, maybe you can ask, when we give journaling to the person, maybe you can say, if you don't have prompt, you can ask. So the prompt were really good. So I haven't written them here, and but was good. So journaling, I think, the prompt at least.
Yeah. Actually, from your question, I was thinking of this problem, but I don't know if it is a problem. Maybe you can tell me, because in the end, somebody comes to you and they have some sort of an issue, work or whatever, but you don't know anything about their work. You don't know anything about their domain. Is that important to know? For instance, they work, I don't know, in a biotech company where they're doing some, I don't know, mass spectrometry, and they have some specific problem, they are overwhelmed by these sort of things. Is it important you know what they are talking about? For instance, maybe if you know that the problem they're talking about is actually a silly thing, but you need to be an expert to know that. Is that important, or is it only about how the person feels?
Actually, you put me in a difficult situation, because it depends on the person who comes, and depends if it's important to the person to describe for himself or herself what he's doing or she's doing.
So maybe that's not okay.
It depends on you. I don't have cut clear answers. It depends on the person. Logically, if he's doing something very much, or she's doing something very much complex, I wouldn't even understand it. But maybe telling me, if it's important for the person, telling me why is telling me this. Maybe there's a step that's very difficult, and it's telling me why it's very difficult. Maybe I don't understand. So it's important if for the person it's important to describe to me
from the person
for certain reason, and it's always good to ask. But they know. That's why the relationship is important, and not everybody can be a good therapist. Not a good therapist can always be a good therapist. It depends on your life, and when you're not in the right place, you shouldn't start. You should stop and do something else, because and actually the other thing that I believe that the really good therapist is when you're young, you're 30, you start, you're too young. You have to be older. Yeah.
Yes. Yeah.
Because life experience is what makes you maybe understand better. And the other thing, it's typical that they say when you start deciding what kind of therapist you want to become, what is your weakest point? If you suffer from something, if you have suffered from something, if you had the violence in your family, if you have drug addiction in your family, if you had a drug addiction, or if you have everything, eating disorder, you have to become the therapist for that.
Because you are the expert.
Because you know how it works. So there is a sort of life experience that you have to bring to the table, and empathy, and so older you get, better you are. I think it's very much a job that you have to start around 60. That's what I think, when you lived all the life, and before that you can be a good psychologist, but it's different from a therapist, or a good counselor as well, which is different from the therapist. I think it's different jobs. No. Any other questions there? Yeah.
Yep.
So you mentioned something interesting about that you need someone to basically express yourself, maybe like to show a picture and get it, and you feel more comfortable, right, psychologically. So what are your thoughts about, like, because we are here just specifically talking about just the models, right? What about humanoids robot, paths, and probably something using the virtual reality, which is like more realistic because it's what brain is everything, right? To your thoughts, you get someone virtually that can get your feeling and give you the what you were expecting, because at the end of the day, all these things are designed for you, right? So do you think that a person will in future feel more comfortable with these things than human beings itself?
I guess some people would. um, Again, we are going back to the idea of what is desirable as well, right? Okay, so yeah, there is a whole philosophical, actually, the discussion about what virtual reality is. Is it actually a type of reality as itself? If somebody is comfortable in a virtual reality and they feel happy, what is wrong with that? I don't know. This again, it will be in the future. I don't really know. I think these are a bit more extreme kind of examples where you see, the again the boundary kind of scenarios where it's hard to tell, unless we get a little bit closer. But it's, I mean, all these things that you mentioned, and you can see them as additional kind of tools or additional refinements of the approach, maybe, or of the let's say of making the relationship between us, humans, and artificial entities a little bit more credible in a way. If it's going to be helpful for therapy, I don't know. I mean, there are studies where there are some sort of robotic pets that they have found they have some sort of benefit. They give some benefit to the patients who had some sort of I can't remember the study itself, but it was a recent one.
Also, the European Japanese project you work with.
Yeah, we also worked on a EU-Japan project some time ago, but this was about not large language models in a traditional way to talk with older people about their daily life, trying to get them more active, try to stimulate them, or answering questions to them when they had something that was going through their mind. So we did some sort of limited research there and the results, and we saw some benefits. Well, the problem is that during the project, ChatGPT came out. So we were using very traditional methodologies, and we were going in a certain direction. Large language models came out, available, and we thought, okay, we had to do everything from scratch. But yeah, so you can see, again, controlled fashion, in a way which is principled and tested. You can see the benefits of having all the additional tools, additional approaches to trying to help, individuals. But what will happen in the future? This is very hard to tell, to be honest.
But I mean, there is lots of therapy now that is online therapy, and all psychoanalytic school don't like it because you have to be present, and the travel itself is worth it. And I mean, I don't agree because
the travel to the
yeah,
place. Okay.
If you arrive late, why you arrive late, all this kind of I don't agree because so they see the body is not there, but you can have clues in other way, and I think sometimes also availability it's very important to have online therapy as well. And some people that are thinking to do online therapy, I'm in contact with Professor Nesci in Italy, and he's thinking to do a virtual world. So there are some, he's a psychiatrist, and there are people who think it can be useful. But it depends the school you belong to, I mean, I'm not, I'm studying psychoanalysis now. I'm not, I don't believe, I believe that now there are these new technological means, that tools that are very important, because I mean, if you are sick with cancer, I mean, how can you go to, you know, a doctor appointment? You know, it's very difficult. You are at home sick with cancer, you cannot move. You know, you need to speak. You need to speak. You need to load, and so it's a very much an important tool that I think, and we should respect that. The problem is that not everybody has access to. You have, you know, I imagine, you know, my dad, you know, and the phone, all the, you know, when people are 80s, 90s, it's everything is so fast, and you have to have a really open mentality, you know, to.
Yeah, that's true.
Open, yeah,
the
you have
speed
to
of change is
open-minded to use all these tools, and you have to have money as well, because you know, you have to have the right phone. Okay, it's true that lots of people have the right phone now, but not everybody. So you have to think about the age, where you're from. So yeah.
And you have to see the real outcomes in the end. You know, it takes years to find out. You know, if a big population, if we really have improvement or not. You can just tell, okay, 2 patients looks like, you know, they are getting better, yeah, but it's not representative.
Yeah, that's true.
You really need big
that's true
groups.
As well. Epidemiology is a very important branch. Yeah.
Thank you.
Are there other questions? Yeah.
Yep.
Hello and thank you. I just want to ask you, like, as you mentioned, for like a psychologist as you wouldn't have like much time in order to cover all the patients. So maybe in future, if I want to go to a psychologist, I'm going to go by rather on site in comparison to choosing an online. But I was wondering, maybe like AI, what could it do for you? Like not like overgeneralize AI like ChatGPT or Gemini, but you as a psychologist, like within CBT, the other one, psychologists within Freudian approach, whomever, they would have like a virtual assistant for themselves, as like if I want to approach you, and therefore within the methodology that you are using, it would rule out whether I need to see you in person, or I could just like going on with the virtual version of you that could help me through the journey that I would need as a patient. And isn't it something that possible in future, that if people would have like kind of obstacles in order to go to a psychologist, because my friend was asking me like, yeah, why people would need a psychologist, you know, even like for you testing yourself to say like, if I need a psychologist or so, it could be also a good channel for people to get into. And I want to know, like, do you think that could be also happen in future, that you would have like a virtual version of yourself that I can approach, and you will rule out, and you would say like, yeah, I'm a suicidal, so I need to come to you like immediately, but someone is depressed, and therefore they could like get to you later?
I think it's a question for you, because
I mean,
it's
yeah,
more
we discussed at the very
technical.
beginning. I mean, I mentioned that we could think of some approach like this, you know, where you have like an assistant or a triage kind of system, or a system which is maybe, as you said, maybe trained on yourself, you know, like in your approach, you know, maybe you can upload a lot of sessions that you have made, you know, if it is, of course, GDPR compliant and everything else, because, you know, you also we didn't discuss something here about the other ethical consequences, but maybe that's for another time. But yeah, I definitely see something like this, you know, could be a useful tool. Again, because it would be in a controlled environment, you know, would be tested, and if you do it, you know, in the proper way, then the therapist would be always in the loop, you know, then they would not, the client or the patient, they would not be just with the tool on their own. The therapist would always look at the logs and see if something, you know, is actually going according to the way it should go. So yeah, that's actually something that I could see happening, definitely. Yeah. Thank you.
Any other questions?
Yep. Closing one? What time? Oh, one. We're late.
So I'm curious what you guys think about this. Whether the problem is not that we're othering AI very much. Like we talk about AI as artificial intelligence, right? So the term itself, artificial, kind of proposes it as I don't know, a presence that is not us. But if you think of artificial intelligence and how it's currently built, it's built from the memories, the texts, the speeches of very many people. So in a sense, it's very much a distillation of human intelligence. So whenever we think of it as something that is outside of us, a stranger, maybe the problem is that we use this term artificial intelligence. And if we were to kind of humanize it a bit more and realize that it's actually many, many people's voices somehow distilled statistically, and you're just talking to kind of a shadow of that through these technologies, maybe it wouldn't feel like so much of a stranger. I don't know what you guys think about this.
I wrote an article about that. It was a conference with lots of artists, and I said that, so first of all, we can speak about extended mind, there is all the debate about this, and the distinction between artificial and nature is very much
debatable.
We have to do a philosophical distinction. I just don't speak about those because it's too much. I'm not totally prepared now, but about this artificial intelligence, I call it a sense that we use the wrong, the wrong terminology. For me, is the emerging of, we put all the data, all the stories, okay. Unfortunately, there are not all the stories, but imagine there are all the stories or everything else is a collective Jungian consciousness. It's the collective consciousness that is there. Because when you ask, there is coming through. It's, I don't know if there is such a thing as a collective consciousness or not, but it is, as you imagine, it was a repository of stories, myths that are actually the first psychologists. These are all these ethno-psychiatrists, very interesting, bit weird stuff, but it's very interesting. So I always thought that if you you put all the story, all the conversation, should emerge the different types of who we are, that are part of yourself, So I call it collective consciousness. It's not, it's really a conference paper, nothing was published, and then, I agree.
Yeah.
I agree. This artificial intelligence, we should, but on the way, it's good to know that it's constructed for the empathy thing, that we should remember that,
Yeah, but on the other hand, I would add, again, we're talking only about language here, so that's
But language can
something-
capture emotion too, right?
I don't know that.
well, with metaphors.
Yeah, but I mean, one thing is to capture, and one thing is actually to be able to have it. So it's true that you can train the models on, all the text, everything. So you will have a huge expert. An expert, for instance, you can help in understanding, some problems of your client or patient that maybe you are not aware of, some other domain or whatever. But still doesn't have a life. And I think, again, as I mentioned Lacan at the beginning, because I think this is his objection, intelligence and thought and language, they are, in a sort of hierarchical almost scale where language, is one manifestation, but then, all the rest is something else that we are losing just, in this so far. Maybe again, we will have the tools or the technology to expand, beyond language, much more, or, the other sensory, like, vision or whatever. But again, I don't know what the future will be.
Thank you.
Thank you.
I think we can conclude. I'm very grateful to.
Oh, thank you. Thank you for having me here. It was really
Fun.
fun and very much challenging, because there are so many things you can explore and not enough time to actually go through much in detail.
And I'm thanking everybody.
Thank
That's,
everybody
very,
for
very
coming
much.
here
I'm
and
very
for
thankful.
joining.
And so, bye-bye.
See you next time.
See you.